In July and August this year, after an intervention from the Information Commissioner, I eventually received a large volume of Freedom of Information records, which firstly, by the way, I was told didn't exist. Within the records, we found evidence of 2 senior clinicians from different disciplines voicing serious concerns about the possible closure of Ona Curra and the impact on residents. We found, and of course, the impact on the wider day service for people in the East Cork area, because now we're left with almost no services and certainly no 24-hour residential services in the whole of East Cork. We found records on the possible sale of Ona Curra being discussed by senior management. We found records on one key decision maker complaining last July that there were only 7 placements available in St Stephen's for Ona Curra residents. Again, a ward setting, which is absolutely contrary to national policy. What's most striking, actually, is the complete absence of records, and I would have assumed that this is of great concern to national running of the HSE. So, for example, there's no record of any clinical decision-making process that led up to the Ona Curra closure. There's no serious and available and transparent decision-making process there that actually talks about the patient's welfare. This is about the states. This is about, and we talked about it at many committees, this is like moving people around on a chessboard and Monopoly, and I'm going to buy a building over here. We have building reports issued by the HSE estates in June 2021, and then Mr. Fitzgerald and Mr. Scully and your colleague Mr. Morrison held a completely unminuted meeting on June 22nd and decided to close that service. So we have no minutes and we have no clinical intervention. So, sorry, Mr. Reid, just to be clear, the HSE is fine with that?
Just, Deputy, to be clear, your representation of us treating people as moving people around a chessboard does not represent the people that I work with.
Well, how would you describe this?
It does not represent the people I work with. It does not represent the people I've met in relation to this service. And it does not represent the engagement that we have had with staff.
That's fantastic, Mr. Reid. Can you provide me then with the clinical process and decision making of closing Ona Curra? Because that's how you prove that you're not moving people around like chess pieces. That's how you prove it. You provide transparent minutes of the decision making. These people were living here for more than a decade.
Yeah, and we provide good, available, suitable accommodation that meets the needs of the people who are living there. And one of the reasons you just mentioned in relation to day service, it was highly inappropriate that day services were having to literally walk through.
Then why did you underinvest in the building for more than a decade and invest nearly more than 3 million in ward-based settings?
It was went out through earlier on about our capital investment process, our decision making, our prioritisation. We have an available capital envelope that we utilise. We prioritise it based on.
Okay, that's a fair answer, Mr. Reid. So now I'd like to turn to the department. The HSE have very clearly said here just now that they are prioritising settings for 24-hour mental health placements that are directly in contrast to our national policies and what we know is best practice for patient care. At what point does the department step in here when it's very obvious the HSE are not doing their job in this regard?
Could we ask Mr. Coleman there as the principal officer would answer that?
I think I'll take that from a mental health policy perspective. In relation to mental health policy, it is important that our service users across both acute and our residential services are provided with high quality accommodation, and that these services are provided in locations that meet standards. So it's not an either or, Deputy, it's around...
Okay, so does the St Stephen's offer a better quality of care for these people than Ona Curra did if it hadn't been actively run into the ground?
So there is a capital plan in place which looks at our residential services as well as our acute hospital services, and as Mr. Reid has outlined, there is a prioritisation that takes place, but that isn't about one competing with the other. It's about the timeliness of ensuring that we can deliver against those plans. So for instance, in the Cork area and in the south, there is a commitment around replacement of residential services where they fall below.
So sorry, just to be clear then, the department where they see the HSE investing more than 3 million, far more than 3 million in groups such as St. Stephen, in settings such as St. Catherine's Ward and St. Stephen's Hospital, which, you know, sorry now, but some of the clinical specialists in the area in It was inspected 3 times by the Mental Health Commission in December 2021 and March 2022. And the lead inspector, Dr. Susan Finnerty, said, "I was particularly concerned to note the culture in one unit was reminiscent of a model of mental health care that might have been provided decades ago. There was a general attitude of negativity about the possibility of improvement in the lives of residents. There was an emphasis on what they could not do, their potential aggression, and the fact that they would always require this type of care." And this is before we're talking about the fact that they're sharing rooms and they're not in a community setting. They're off basically in a field in the middle of nowhere. I went and had a look. It really is something from the 1950s, and Ireland obviously has a very grim legacy in that regard. Now, are you telling me that when the HSE makes a decision to underinvest in a building that had an excellent service and was right in the middle of a town and people were living in their own rooms for a long time, I'm sorry, Chair, and I do want to put my hand up because I want to come back to Garnet House for the next round. Are you telling me that the department at no point intervenes in estates management in the HSE to say, is the cost-benefit analysis here in line with national policy?
I think that's, yeah, so it's an important point, and we do have a policy, a national policy, a 10-year policy called Sharing the Vision, and it is really important that any investment in our capital infrastructure aligns with that. And you're absolutely right, it is a move towards community infrastructure, but it has to be balanced against the need to ensure that the services and the infrastructure that we have are...
So, sorry, I know I'm at the end, Chair, but so you're...
No, I have to,
Okay.
no, unfortunately, we have a day where everyone, there's full attendance.
Could have done the 2 hours by myself.
Gets in.